This is a syringe, a simple tool of modern medicine, right? In the right hands, it can save a life, but in the wrong hands, like at this hospital, it became a weapon. For over 300 children, one single injection meant a lifetime of living with HIV. This isn't just a medical story, it's about how a place meant for healing turned into a source of pure nightmare. One family's story sadly began just like too many others. They took their children in for a routine treatment, trusting the system that was supposed to protect them. Instead, they left with a devastating diagnosis that would change their lives forever. In the city of Tanja in Punjab, Pakistan, a silent crisis was brewing. It didn't start with a government alert. Instead, it was a local doctor in a private clinic, Dr. Kazrani, who first noticed something wasn't right. In late 2024, he saw an alarming pattern, an unusual number of children who were testing positive for HIV. The common thread? Almost all of them recently received treatment at the government-run Tahsil headquarters or THQ hospital. As more parents came forward, the sheer scale of the tragedy became undeniable. Between November 2024 and October 2025, data from Provinical screening programs and other records would identify a staggering 331 children in Tanzania who had tested HIV positive. To rule out other causes, investigators even tested the parents. Out of 97 families tested, only 4 mothers were found to be HIV positive. The evidence was crystal clear. This wasn't a crisis of mother to child transmission. The virus was spreading from right inside the hospital. Among the victims were 8-year-old Mohammed Amin. His final days were tragically marked by severe fever and intense pain before he passed away shortly after his diagnosis. Soon after, his sister Asma also tested positive. Their mother, who tested negative for the virus, believes both of her children were infected by contaminated injections during routine care at the hospital. Following those initial reports, Punjab authorities promised a massive crackdown in March 2025, and the hospital's medical superintendent was even suspended. But according to an insider, nothing really changed. This led BBC investigators to go undercover in late 2025. Over just 32 hours of secret filming inside THQ Tanza's children's ward, they documented a shocking reality. The photos revealed repeated and serious breaches of even the most basic infection control. Investigators saw staff reusing syringes on multi-dose vials of medicine on at least 10 separate occasions. In 4 of those instances, medicine from the very same vial was given to different children, creating a horrifying chain of potential transmission. A leading Pakistani infectious disease expert, Altaf Ahmed, explained the danger to the BBC. Even if they have attached a new needle, he said, the back part, which we call the syringe body, has the virus in it, so it will transfer even with a new needle. The investigation also documented staff administering injections without wearing sterile gloves, leaving used needles exposed on countertops, and improperly handling medical waste. When the new medical superintendent of the hospital, Dr. Quasem Bazdar, was confronted with the undercover footage, he dismissed it, suggesting it might be staged or outdated. He confidently told reporters that parents should continue to seek treatment at THQ Tanza. But for hundreds of families, the damage was already done. The fault has been catastrophic. Children who went in for simple ailments are now facing a lifetime of antiretroviral therapy. The diagnosis carries a heavy burden of stigma and financial strain, forcing families to travel to distant treatment centers. To date, at least 9 of Tanza's children have died after contracting the disease, and new cases were still being identified as early as 2026. This tragedy sadly isn't an isolated incident. It echoes a 2019 outbreak in Lakana, where over 900 children were infected under nearly identical circumstances. And in 2024, more than 30 Dallas patients at Nishtar Hospital in Multan contracted HIV due to scandalous negligence. It all points to a systematic failure within Pakistan's healthcare system, plagued by an over reliance on injections, with 70 to 99% being medically unnecessary, chronic shortages of supplies, and poor training. In fact, Pakistan now has the fastest growing number of AIDS cases in Asia. This cycle of unsafe practices, reactive suspensions, and a lack of meaningful, systematic change continue to put countless lives at risk. The families of Tanza aren't just fighting for their children's health. They're fighting for answers and for accountability. They're fighting to ensure no other family has to endure their nightmare. The story of Muhammad Amin, his sister Asma, and the hundreds of other children is a devastating reminder of what happens when a system designed to heal betrays the most vulnerable. It leaves us with a haunting question. When the guardians of public health fail so catastrophically, who was left to pick up the pieces?